Degenerative or osteoarthritis is far from inevitable, and luckily many people will go through life without ever experiencing the pain of arthritis at all. Nevertheless, there are some things which make us all that little bit more susceptible to degenerative arthritis. These things include age. Cartilage, together with other structures within our joints, does become weak and wear out with use over time, which inevitably means that age is a factor in the onset of this disease. So, while you may well reach the age of 90 without experiencing arthritis, your chances of doing so increase after about the age of 45. Joint injury. If you sustain any sort of injury to a joint as a result of trauma, then this joint is at risk of developing arthritis. Injury can come in many different forms, from a car accident to a sports injury, or perhaps even a simple fall at home. Repetitive strain. If you have used a joint repeatedly and excessively, then that joint again is at risk of developing degenerative arthritis. Repetitive strain is often seen in dancers, bowlers in cricket, assembly line workers, and computer operators, amongst many others. You are a woman. Women are at greater risk of developing degenerative arthritis than men. Indeed, women are about 3 times more likely to develop osteoarthritis than their male counterparts. One or both of your parents suffered from degenerative arthritis. There is a fairly clear genetic component to degenerative arthritis, and this is particularly true of degenerative hip arthritis, which is inherited in about 50% of all cases. And finally, you're overweight. If you are carrying excess weight, then this places pressure on your hips, knees and ankles, which over time acts very much like a repetitive strain on those joints. Excess weight places particular strain on the knees. While degenerative arthritis can strike just about any joint in the body, it is most commonly found in the neck, the lower back, the hips, the knees, the ends of the fingers, and the base of the thumbs. In most cases when this disease strikes, you will experience one or more of the following common symptoms. Joint pain. Perhaps the most commonly reported symptom of degenerative arthritis is pain in the affected joint. This is normally a quite distinctive pain, which is experienced as an ache which radiates out from the very core of the joint. The pain normally increases if you use the joint and subsides if you rest it. Over time, however, the pain tends to grow to eventually become more or less constant and lead to difficulty in sleeping and thus to fatigue during the day. One curious sign of arthritis pain is that it often increases just before it rains. This is because rain is normally preceded by a drop in barometric pressure, which also causes the lining of the joints to become inflamed and to release excessive fluid. Joint stiffness and reduction in movement. Arthritic joints are often stiff and display restricted movement. In advanced cases, the joint can literally freeze altogether, often with the affected limb left in a strangely bent position. Swelling, tenderness and warmth around the joint. Swelling is not generally a major problem with degenerative arthritis, but it can be experienced and is most often seen in the fingers and the knees. Cracking joints. In some cases of degenerative arthritis, you will hear a cracking or a popping sound when you move a joint, and this sound is created by the rubbing of roughened cartilage. This shouldn't be confused with the sound generated when we deliberately crack our knuckles by applying pressure to them. In this case, the sound is generated by the release of nitrogen gas, and this has no connection at all to degenerative or indeed any other form of arthritis. And finally, bony finger growths. You may experience bony growths known as Heberden's nodes, which appear at the tips of your fingers, or bony growths known as Bouchard's nodes, which appear at the middle joint of the fingers. This is believed to be a genetic component to these bony growths. The presence of one or more of these symptoms of degenerative arthritis does not in itself confirm the presence of the disease, but it is a good indication that you might have the condition, and it's a sure sign that you should seek expert advice from your doctor. With so many different types of arthritis, the only way to positively determine whether or not you have degenerative arthritis is to X-ray the joint in question. Here, we're looking for the presence of one or more of the following signs: a degradation of the cartilage, an overgrowth of the cartilage, a narrowing of the space within the joint, bone spurs, pieces of cartilage or bone which are floating free within the joint fluid, and finally any signs of deformity of the joint. If you'd like to learn more about degenerative or osteoarthritis, then please visit arthritisquestions.org today.